Hello and welcome to the Pete's Way. Today we will be discussing a very important topic, headache. Okay, this is one topic that you face daily in routine in outdoor departments. You need to differentiate between different types of headaches. So I thought that this may be of help to you. Okay, so we will be talking about different types of headaches, how to differentiate between them on the basis of history, and we will be discussing briefly the red flag signs that you need to know so that you don't miss anything that is important. Okay, so before I proceed further, I will request you to please subscribe this channel and hit the bell icon. Okay, so without wasting any time, we will be discussing types of headache, and we will be discussing differentiation between them, and third, red flag signs. Okay, so headache. First of all, we need to know the causes. When a patient is presenting to you, you should know the causes that you need to rule out on the basis of history. Only then you can rule out them. Okay, so the number one cause you should look for is tension headache. Okay, then there is another headache, we call it as migraine. Okay, and another is cluster headache, headache due to CNS infections. It can be due to we have done tension, we have done migraine, cluster headache, CNS infections. It can be referred pain. Okay, it can be vascular causes like subarachnoid hemorrhage. Okay, it could be due to increased intracranial pressure, we call as benign intracranial hypertension. Okay, it could be post-traumatic, and it could be due to medication overuse. Okay, so these are the causes we are going to talk about. Okay, so first of all, we will be taking one cause at a time and we'll be discussing it. Okay, so tension headache. This is a very common headache and you need to know about it. Okay, actually, what type of headache is in tension type headache? There is band like constriction, very important, band like constriction on forehead. Okay, it is on the forehead and it is just like a band squeezing pain. Okay, and trigger is, it is triggered by stress, fatigue, lack of sleep. Okay, so tension type of headache is like a just like a band on the forehead. It's just a squeezing pressure. Okay, and it is triggered by uh, the stress, fatigue, or lack of sleep, maybe hunger. Okay, so you need to know about them. However, there is no vomiting. Okay, no vomiting, no abdominal pain or other systemic symptoms. Okay, so one we have discussed is tension type headache. Okay, now we are going to discuss other type of headache, migraine. Okay, this is a very common headache. It's very important to note that migraine can be located in one half of the head or it can be in the both half. Okay, so this is not a hard and fast rule, it can be both. So there are two types of migraine. Okay, one is common migraine and other one is classic migraine. Okay, you need to know the difference between them. Okay, common migraine, it occurs at school age. Okay, there is no aura. What do you mean by aura? Aura is the feeling, or it can be visual feeling, it can be auditory feeling, it can be like flickering of lights, like zigzag lights. Okay, it can be just a feeling that a headache is about to be starting. Okay, so you need to know about aura. So in common migraine, there is no aura. The type of headache is throbbing, okay, and poorly localized. Okay, and there can be nausea, vomiting, photophobia. Okay, but there is no aura. This is very important. While on the other hand, classic migraine, one thing to remember is that there is positive family history. Okay, and there is aura. It can be auditory, it can be visual, it can be like blurred vision, like scotomas, like flashing lights, zigzag lines. Okay, or maybe some problem in vision. Okay, there can be nausea, vomiting, photophobia. Okay, movement and noise problems, and it can be preceded by transient neurological deficit. Okay, like numbness, tingling, hemiparesis, aphasia. Okay, so you need to know the two type of difference: common migraine and classic migraine. Okay, so now we are moving on to the third type of headache, which is cluster headache. In cluster headache, okay, this rapid onset there is rapid onset and pain is localized near the eye region. Very important. And most of the time there is lacrimation from the affected eye. Okay, so pain is rapid in onset, localized around the eyes, and it is accompanied by lacrimation, rhinorrhea, okay, and maybe sweating and nasal congestion. Okay, and it can last for around 30 to 90 minutes. Okay, so to sum up the cluster headache, um, it is rapid in onset, it is localized around the eye and temporal region, it is associated with lacrimation of the affected eye, rhinorrhea, nasal stuffiness, congestion, and sweating. Okay, then important cause to remember is infectious, we talked about CNS. Okay, in CNS infections, there can be headache. It will be severe with fever, maybe with vomiting, okay, and later on maybe leading to altered state of consciousness if it is meningitis or encephalitis. Okay, so this is the one which you can't miss. The parents will be complaining that he has high grade fever for last 2 days and he has headache and he is vomiting. So you need to rule out the meningitis. You need to look for the signs of meningeal irritation, which are neck stiffness, okay, kerning and Brzezinski. You need to look for them. Okay, so we have done the meningitis. Then in very important causes, tumors, CNS tumors. Okay, so in tumors there is a long standing history. Okay, maybe 2 weeks, 3 weeks. Okay, long standing history of weeks. Then it is progressively increasing. Okay, and maybe it awakes from the sleep. Okay, and classically there is early morning vomiting. Okay, and always look for focal deficit, maybe in eyes, maybe in any part of the body. Okay, look for the focal deficit. Because if the tumor is around optic chiasma, it will be defecting the vision, and if the tumor is in the cerebellar region in posterior fossa, it may be affecting the balance of the patient. So the important thing in tumors is that there will be a long standing history, okay, and it will be increasing progressively, associated with early morning vomiting and maybe focal neurological deficit. Then we have vascular headache. Okay, in vascular headache, it can be simply due to high blood pressure. Okay, so always check BP, and it may be due to we call a subarachnoid hemorrhage. Okay, remember, subarachnoid hemorrhage is, you can remember it like the most severe headache in life. Thunderclap, most severe headache one ever has had. Severe like thunderclap. Okay, very rapid onset. Okay, so in vascular headache, you need to screen for two things: high blood pressure and subarachnoid hemorrhage. Then is another cause we call as benign intracranial hypertension. Okay, so this is in this cause, mostly the child will be obese. Okay, child will be obese, increased weight. Okay, and he will be having severe headache, and he will be having problems in his lifestyle. Okay, so you need to measure his blood pressure may be raised. Okay, and when you will check his eyes fundus, you will find papil edema, and if lumbar puncture done, you will find increase in pressure of the CSF at lumbar puncture. So in summary, benign intracranial hypertension, it is mostly in obese children, or maybe in 12 years, 13 years, boys and girls with severe high blood pressure due to raised intracranial pressure. Okay, now we are coming to a cause we call as referred pain. Believe me, this is the one you don't need to miss. If you miss this cause, you are making a blunder. Okay, always look for the referred cause. Maybe the cause is sinusitis. Okay, if sinusitis, maybe there is frontal sinusitis and he is having the frontal headache. Okay, second important referred cause is toothache. Okay, toothache can be referred to the head and can present as headache. Similarly, earache. So rule out these causes of referred pain. It is must: earache, toothache, sinusitis. Look for any otitis media. Okay, it is very important. Referred pain, you can't miss the referred pain. Okay, then we have talked that there is can be a medication overuse headache. Okay, so in this the condition is that you are using the medicine again and again for painkiller, and this is leading to the medication overuse headache. So you need to be asking in history about the medication you are using for the headache. If he is using regularly painkillers, okay, and there is no other cause, so you need to consider medication overuse headache. But you have to rule out other causes we have discussed before reaching to the diagnosis, this one. Okay, then we have called maybe post traumatic, we call as post concussion syndrome. Okay, you had trauma, maybe there is subdural hemorrhage. Okay, this is leading to the post-traumatic headache. Okay, there may be other causes like some foods, some food additives, caffeine. If you are taking a lot of caffeine and you are withdrawn suddenly, caffeine withdrawal headache can be there. Okay, and there can be in other causes, there can be eye problems like refractive errors of the eye. Okay, and eye strains. This can lead into the headache and head problems. Okay, so now we will be discussing the red flag signs. Okay, in red flags you need to know the red flags for headache so that you don't miss. You need to, if you are not able to evaluate the red flags, you are in lot of trouble. Okay, so number one red flag in, ask about, does it awakes from sleep? Okay, so most of the organic causes of headache, and similarly in other problems also, um, the things which wakes up from the sleep do consider organic cause. So the second thing in red flags you need to ask about is morning headache. Okay, if the patient is having morning headache or on lying down, you need to take it in account. Okay, then occipital headache. This may be suggesting the vascular cause. Okay, and headache worsened by coughing and straining. Okay, or bending down or in changing position. This is another red flag. Increasing severity of headache. Okay, and new onset lethargy. Okay, and not the least, change in behavior or school performance. Okay, so you need to be knowing these red flags in history. This is the point you need to ask. You need to ask, does it awake from the sleep? Is there morning headache? Is it just localized in the occipital region? Is it worsened by coughing and straining? Is there is increasing severity of headache? There is new onset of lethargy. Patient is feeling just lying down, is feeling not active, and maybe there is change in behavior. So in the end, we need to do the red flags on examination. Okay, what will you look in examination for the red flags? Check meningeal signs. Okay, check meningeal signs, the altered state of consciousness, papilledema, high blood pressure, and focal neurological deficit. So, to sum up, these are the red flags on examination: signs of meningeal irritation, altered state, papilledema, high blood pressure, and focal neurological deficit. Okay, so to sum up, we have discussed different causes of headache, their types, and how to differentiate between them on the basis of history, and what are the red flags on the history and examination. And that's all for today. If you like the video, okay, give the thumbs up, do subscribe, and hit the bell icon that is like this. Yeah, hit the bell icon. So that's for all for today. Thank you for watching.